survey, and I'll paraphrase it. 7 billion people in the world have 18 billion cell phones, something like that. And they use them to get education. They use them for consultation. Wise governments are using them to issue alerts just in time. And very wise governments are collecting data from the cell phones for monitoring of public health. Here's an example. In Africa, in Kenya, they had a problem with two problems that they used cell phones for. One was unclean water. And when there was cholera or some form of diarrhea in the village upstream, cell phone networks sprang up spontaneously, which they called ushahidi, which is a Swahili word for, well, sort of a word for knowledge. And this would tell people that you shouldn't drink water from that particular stream. And then they began to use ushahidi for corruption. And people could anonymously report that this government official or that government official was corrupt. And this had a striking effect on the officials. And let me turn to Haiti. Having been there quite a few times, thanks to a company represented here by David Sharp, sitting in the back of the room, Digicel, many, many Haitians have cell phones, more than half. In a desperately poor country, they have cell phones. And when they were trapped beneath the rubble in the earthquake, and they couldn't get a cell phone call out, they were able to text. 90% of the people that we rescued from the rubble had alerted their presence by texting, not by cell calls. And I think some of you alluded to this earlier. So my point here is that World Safe is a little bit different from the usual international humanitarian aid effort. In this case, we have more to learn from the world than the world has from us. It's going to be an interesting dialogue, and I think Len Pagano's to be congratulated for taking the lead on it. Let me turn to one other point of my friend John Zogby's latest survey, and then he can speak for himself. And I think you'll gather I'm putting words in his mouth here. People will give up lots of things before they give up their cell phone. They will give up their TV. They will give up their bicycle. They will give up their car. They will give up, what was the other thing our survey showed? They will give up, oh yes, all their former spouses before you can take the cell phone away from them. So this is a commodity which is prized outside the U.S. even more than we prize it. So it's a terrific thing, and I want to commend Safe America for picking this theme, which not only will do some good in the U.S., but will do some good around the world. And with that, I want to introduce the person who really has an understanding of the global issues, Dr. Eric Noji. Thank you very much, Len.
The PowerPoint is being set up. I just want to say I'm absolutely delighted to be here and quite honored, and also to thank Len for putting me in touch with lots of old friends, not old chronologically, but I want to just signal out my very good friend, Dr. Annie Sobel, who has the distinction of being the very first flag officer rank individual, by that I mean Army General, Navy Admiral, that I was a friend with. I couldn't believe it. We actually were on a first name basis. She called me Eric, and I called her General. But all kidding aside, I still call Annie. It's good to see you, and Rob. Well, as Dr. Cassells has mentioned, we've been working with Dr. Jacques Garcia, who was the former Deputy Director General of the Pan American Health Organization. And just thinking back over time, what was done during his tenure as Director General of PAHO, one of those programs really rang a bell, and that was called A World Safe from Disasters. And I think that I don't know what came of that program, but it was a lot of the lessons that Dr. Garcia instituted in Latin America for disaster preparedness, cell phones for health, the use, much more extensive use of internet access for decision-making in disasters, direct result of the support that Dr. Garcia gave to his staff, which probably in the WHO family of regional offices, PAHO is the office of the World Health Organization for the Americas, probably the finest staff, but they took that ball and ran with it and made major contributions in the area of information communication technology. Well, I don't have to go through what this day meant for all of us. It changed all of our lives, personally, professionally, on a scale which still affects us every single day, certainly every time we go to the airport. The problem, and it's a big problem which isn't going away and is getting worse probably due to a variety of environmental and population pressures, tremendous growth of disaster preparedness and relief industry. I mean, that's what it is. It's an industry. At a very minimum, $12 billion a year, and most of that is for providing food aid globally. High-profile disasters affecting all parts of the world, from Hurricane Katrina to the earthquake in Haiti, Darfur refugee situation, and earthquakes in China, and record number of players in the field, mostly new and inexperienced. And it's particularly that last issue that calls for some attention, because there's really no way that you're going to stop people from wanting to do good, wanting to provide aid, wanting to help people. And if they're going to be doing that, we just want to make sure that they are basing what they do on evidence, on science. Those of us in medicine, there's a phrase that we talk about in terms of quality assurance, quality control, but it's called evidence-based medicine, making our decisions on how we treat our patients based on science and on the results of research. Well, we should be doing the same thing in our response to disasters. I mean, just looking at an affected country in a disaster, knowing who the many organizations are, what their roles, responsibilities, their mandate, it's very confusing. It's confusing for me, and I've been in this field for most of my adult life, but for new organizations and the thousands of volunteers that went down to Haiti, for example, they were very unfamiliar with what has come to be called the fog of relief. I mean, just knowing who to work with and who is credible and who is not, and who should we be giving money to and donating to the many charitable organizations that popped up in the advent of the Haiti earthquake. Problem's not going away. Unfortunately, this was a recent survey by the International Crisis Group. Despite the problem of hunger and natural disasters and industrial disasters, our response is unprepared and at times overwhelmed still, despite billions of dollars we've spent over the last 20 years on education and preparedness. Major challenges: accountability, performance, and using the results of research to develop more effective learning tools. Accountability, this is something that the humanitarian community has never been subjected to before. In the past, when money flowed, as long as you said that you wanted to do good, there was really no accountability for your performance in the field. Well, despite the fact that there's a lot of money in humanitarian aid, it's a limited pot, and there's more organizations that are competing for a piece of the pie, I guess you'd call it. And from now on, they're going to have to be accountable for what they do and demonstrate that they're using the taxpayers' money, they're using the UN's money and other charitable organizations' donations, that they're using it in an effective manner. And before we can decide what is effective, we've got to have performance metrics. We've got to define minimum standards, metrics, and that's one thing that Safe America has taken a lead role in. And I saw my former colleague at FEMA, Marco Bourne. I don't know if Marco's still here, but he has been working a lot with developing ways of measuring preparedness, which is quite a challenge. So accountability, like I said, it's once it became quite apparent that a lot of money was being spent in this area, and because of that, we have to be better stewards of the use of that money, whether we work for the federal government or whether we work for an NGO. I will go through that, but just look at the last 10 years, the percentage of humanitarian aid has risen from 1.5% to 18% of total overseas development assistance. That's development assistance. That's aid by the European Union, Japan, the Scandinavians, and of course the United States. Performance, how are we going to be able to hold organizations accountable for what they do in their field and their performance, and unless we have metrics, and that we're going to have to develop ways of quantifying a successful intervention, whether it's food relief, whether it's infectious disease control, whether it's shelter, whether it's water and sanitation. There's got to be some way of measuring what is a good job. Here are just problems that we grappled with when I was at the Centers for Disease Control, and after 9/11, CDC came into a lot of funding that went to states and universities to establish better preparedness programs, both academically for research as well as to bolster staffing in departments of health at the state level. CDC is an agency that was formed to serve the states, and that was our major constituent. But with all this money coming through CDC to the states, we had to develop measures of how the states were spending that money, and then ultimately using their performance on whether they would get the same amount of funding or more or less the next year. This is something that, at least in disaster medicine, we have no metrics for preparedness, and there's a lot of work that needs to be done in the area of measuring effective performance in the health and medical response to disasters. One major effort at the global level is the SPHERE project, which is an attempt to look at the major things in a disaster response: food, communicable disease control, clinical medical services, epidemiology, nutritional assessments, vaccination programs, and developing some minimum standards of, well, how much water per day does each person need? How much space does the individual need in a refugee camp before we can say that it's overcrowded? How many latrines do we need or how many people per latrine? And it took a long time to develop these, but they did come up with them. And Haiti is going to be a major watershed because the next edition of the humanitarian charter is going to be coming out next year, and a lot of the lessons that we learned and new things, information and communications technology, there was no module in the previous version, which is 2004. Well, the next version, there's going to be a whole module of the 6 modules. I think one of them is going to be on the use of the internet, social media, social utilities, voice over internet protocol, and all the other things which were used in Haiti. And also fascinatingly on the tsunami off the coast of Chile as that approached Hawaii. A lot of lessons that I'm looking forward very much to seeing them published. Standards are needed, and then active learning, taking the results of that research and feeding it back into a process of active learning is defined as during the emergency itself, having so many people who are inexperienced, how can we teach them quickly? One example is a just-in-time lecture program by the University of Pittsburgh. But this is an attempt to address the fact that so many uninformed people, inexperienced, respond to disaster, and that's just going to happen. No way to stop it, basically. Getting them up to speed as fast as possible with on-the-job training. That's basically what active learning is. Linking learning to accountability and performance. Otherwise, unless we develop disasters into an academic and respected field and publish the results of what happens in disasters, which I've tried to do over the years, a lot of the myths won't die that many people take for granted, like there are epidemics after all disasters, dead bodies cause disease, which are just simply not true, but many people continue to believe that, the myths of disasters. And what I really liked about the World Safe is it focuses on the most important element of disaster response. And the only disasters I've seen well managed are those disasters where you had well-trained people and well-trained people who knew each other and had worked together in the past, because trust is so much a part of effectively cutting through a lot of the government and UN and other bureaucracy that builds up in a disaster. So nothing replaces trained, competent, and motivated people, and I think people are the most important asset, and that's one thing that Safe America does, and that is the intent of World Safe. So I think that I am going to end my comments with how can we improve the global emergency readiness? And the answer is pretty simple, but simple in concept, but difficult in implementation. We need better teachers, we need better lectures, and we need mentors and role models. But for a variety of reasons, sometimes it's very difficult to implement good ideas in large bureaucracies. And there were times when I was in federal service, although I loved my time at CDC and I wouldn't change that for the world. Implementing new ideas, it's an art form. But ultimately, we were able to work things out, and it could take a while, but working things out also very fine art, and getting consensus. So the way forward in collaboration with Safe America, just some of the topics which came to mind. What's going on right now? Who are good partners? Where can we learn lessons from past efforts? And what can we do in the future? And I think one of those that we've been discussing is a curriculum development, to develop a curriculum that might be based on minimum standards of performance for better quality assurance and quality control in disasters. So thank you very much, and I look forward to the rest of the day's events. Thank you.
Eric did a great job of summarizing a very complex area, and we have a lot of interest. And I'm going to go back to this last slide just a little longer, Eric, because I want to emphasize that in recent conversations with you, Tripp, and Joxel, we've talked about each of these line items on this slide. And one of the things that we've mentioned, I think already, that we're looking at having an event in New York, February 25th, where we would plan to give our first World Safe Humanitarian Award.